everyone, this is Ricky Spencer and welcome to another Quest by Community, Our Health Matters. And today we've got a real fabulous guest, a personal friend, a wonderful colleague who's inspired many people across Australia. He's won many awards and accolades. Somebody who recently won the Australian Social Worker of the Year, a person who has delivered over 10,000 courses on a particular topic that we're going to mention today. I'd like everyone to welcome AJ Williams.
Hi, thank you, Ricky.
Lovely, AJ. Now tell us a little bit about yourself.
I'm an Aboriginal man, Wiradjuri and Wotjobaluk. I'm a nurse. I trained to be a nurse. I started nursing when I was 18 and specialised in maternal health and mental health. Worked as a nurse for about 6-7 years. Got a back injury and it's really hard to be a nurse and not be able to lift. So I went back and did my bachelor and my master's of social work. So for the last 27 years, I've been a social worker, predominantly working in Aboriginal health and mental health.
And it's quite an extraordinary story that that you've told many times to many people and in many spaces about that journey of finding who you are and your identity. And I was reflecting prior to us coming on today, going back to some of our, in times that we've worked closely together and reading some of your work. And I remember for you, it was that sense of trying to find yourself, you know, when you were 17. And, you know, what career will I go to? And I thought for those people who are listening at the moment in our audience who are perhaps, you know, Indigenous, not quite sure what they want to do, tell us about your journey, because it was quite challenging. It wasn't easy.
No. I grew up initially in care and then I got adopted. When I was 14, I found out that I was Aboriginal, and between 14 and 17 at high school, I was bullied a lot, and it wasn't a great experience at school. So I never finished high school. I finished year 10, but didn't get to year 12. I fell into nursing by accident. I didn't know what I wanted to do, but I knew I liked helping people. I knew I liked sharing stories with people, and an opportunity came up at the hospital as a nursing student, and I went, I think I could become a nurse. And I really enjoyed the years I spent studying nursing because it got me to see different aspects. So I did some surgical nursing, which I'm not really good at. I'll be honest with you, I passed out in surgery. So I realised that being a surgeon nurse is not what I wanted to be. I worked in aged care, worked in maternal health, mental health, and I ended up specialising in mental health and maternal health.
And I just want to take you back to when you were studying nursing.
Yes.
It would have been a time when it was difficult, one, to be a male.
Yes.
And take on a predominantly female type profession. And on top of that, an Indigenous man.
Yes.
How did you kind of come to terms with that? And was that an issue for you, that like your Indigenousness? Was that something that you had to kind of deal with, that challenging for you?
I never hid the fact, but I think what people need to realise is that at the time nursing was it still is sometimes a very biased kind of profession where people don't know what they don't know. And as an early nursing student, I was a bit scared to actually tell people anything about my Aboriginality because of the comments I was hearing from my colleagues at the time, especially when Aboriginal people turned up in the emergency department, for example, and you'd hear comments like, oh, they were frequent flyers, they're here all the time, and you hear all the stereotypes. And being quite young, it's like, how do you actually tell these people that are bagging out a particular group of people that, you know, that I am one of those people? So it was easier not to say anything for fear that this is the only job I've got, and if I do disclose it, what would be the consequences of me disclosing? But as people got to know me, I was more comfortable in sharing that story. But you are right. I think the other thing is being a male. In my group, I was the only male student in my actual nursing cohort. if that makes sense. So it was quite an interesting experience. I was looking, when I reflect back on it, I think what I really loved about it was having positive female role models around me that made me take on a lot more of understanding the discrepancies between men and women in terms of the power imbalances, if that makes sense. Because when you're in health, the director of nursing was female, my charge nurses were all female, most of my colleagues were female. And it did give you a different perspective of how things could be. But then when you go outside the nursing field, you see that most of the CEOs and the board were all male, if that makes sense. But look, I loved my time doing nursing. Do I miss it? I don't miss the shift work, getting up and being up at 6 o'clock in the morning to be on the ward at 7. But the things I do miss is, I specialised in maternal health and mental health. So I really do miss sometimes working with babies and young mums, and watching that moment where the baby kind of bonds with mum and going, oh, that's so sweet, and being part of the whole birthing process.
Maybe that's something that has assisted you in your transition to study and then engage in a really long and ongoing career in social work.
Yes, social work actually came up because I actually got injured at work being a nurse. And I hurt my back, and it's really hard to be a nurse and not be able to lift. So I think, what else do I want to do? So I kind of looked around the hospital, and I thought, I actually quite like what social workers actually do. And I thought, no, that's what I want to do. I actually want to look at more of, as a nurse, it's very medical model. So, and it's like diagnosis, treatment. So someone comes in a hospital, you treat them, and then you kind of discharge them. But what are all the issues that this person has, or what's their circumstances that they're being discharged to? And that's what I liked about the social work component is, if we're going to release them from hospital, where are they going to, and what support do they need when they actually get home? And social work was what I wanted to do. And my first placement in social work was in a hospital. And my first job after social work was actually in a hospital. And I'm glad that I had both those experiences, because it actually made me feel comfortable coming from a nursing background into social work, because I was still in the same health area, to help the transition a lot better.
It's interesting that a lot of people who similar professions tend to gravitate between health, nursing, social work, teaching. It's sort of like those sort of elements. And I can see in your journey, you've sort of taken all that, and your love or passion for mental health obviously perhaps comes maybe rooted into your own experiences of your early years and trauma.
Yes.
And I know we've talked a lot about your, coming to terms with your indigenousness,
Yes.
and then dealing with other things of, trying to find your journey in life as a young man, navigating that. What got you interested to do the mental health courses? And for our audience, because I just want to preface everyone by saying, before we hear this story, tell us, how many people have you now trained?
Over 10,000 people in 900 actually this week will be my 900th course that I've actually delivered.
For all the people listening out there, imagine that's a whole stadium, which we say, of people who've been trained by this Australian of the Year social worker.
So how did I get into it? I've always been interested in young people's mental health. It's well publicised that I actually had an eating disorder while I was growing up. I've been doing a lot of work as an ambassador for the Butterfly Foundation for a number of years. So it's all out there that I did have an eating disorder. But it really started at school while I was being bullied quite a lot. And it's really hard to try to juggle life in general when every day you're copping it because you're either being bullied because I was Aboriginal, being bullied because I was in care, because I was bullied because I was just being bullied all the time. And people don't realise that bullying doesn't just occur at the school, it occurs at the bus stop. And the bullying probably isn't as bad, or I don't know how to say this in a different way, but we didn't have the social media that we have now as well. But it was pretty bad, and the only thing I could really control was what I could eat and the way that I could actually cope with stuff. When I started doing nursing, I had an opportunity to actually work with young people in the psych unit. I could actually see parts of myself in a lot of people going, well, there are underlying causes that cause mental health, psychological distress, trauma, drug and alcohol. And I could see myself being able to work through some of this stuff. And that's when I got the passion to actually go, I just don't want to work with the people that actually have or live with these conditions. And notice how I said live with these conditions rather than suffer from them, because you know, I live with anxiety disorder, I live with certain aspects. I don't always suffer from them, even though some days it might feel like that we're suffering. But I actually wanted to actually educate families on what are the signs and symptoms that this person might be going through, because it's the support that the person needs when they leave the hospital setting, the acute setting. If you're going to send them back home, what support does the family give them? What support does the family know is right or wrong? But what things can people say? What things can people do to make the person feel culturally safe or safe in themselves?
It's interesting that you made that connection between understanding how people cope, especially young people, maybe sometimes through the trauma of going into a hospital setting, maybe for the first time that external people have identified there is something wrong. And I know in our communities that language of mental illness is embedded in a lot of stigma and shame. Your course, however, what I really love about it is you provide many practical examples that allows any person, you don't have to have a degree, you can be a mum and dad, a brother or sister, a person on the street who can help. Why is that so important?
Well, I think it's about breaking the stereotypes that you can't do anything. And people go, well, someone gets unwell, I didn't see any signs and symptoms. There are signs and symptoms there, but if people are not trained in knowing what to look for, then you can obviously miss the signs and symptoms. So the course is actually breaking down, well, what are the signs and symptoms of the most common mental disorders? And so the most common mental disorders, anxiety, depression, psychosis, drug and alcohol, and getting people to look at the early signs and symptoms and being able to start conversations with people as soon as you start to see something that's not right with somebody. We know that mental health first aid is just a conversation, but it's a conversation that can save someone's life. And what I love about the course is that it teaches you not to be scared to actually have those conversations, because people actually go, well, I don't know what to do, so thus I do nothing. What the course actually does is actually go, well, think about who you deliver or who you have conversations with. They're often people that you know, your friends, your family, your parents, your mum, your dad, your brother, your sister. So I look at it in a way, and I'm pretty sure I would have explained it, you know, when I train, is that I know how my brother responds when he's unwell, and I know how he responds when he's well. So if I start to see something a little bit different, and that's not their usual self, that prompts a conversation. And it might be just a simple conversation with like, you have been traveling your usual self lately, do you want to have a bit of a yarn with me? And it might be, everything might be fine, but I won't know unless I have that conversation. Mental health always affects your thoughts and feelings first, and I can't see someone's thoughts and feelings. We often pick up things in behaviour, but we do know that as soon as we pick it up in behaviour, it means the person's been a lot more unwell for a lot longer than what I've actually really seen. So it's actually going back to, as soon as you notice something, don't be scared to actually have a conversation. And I think a lot of the courses, that professional courses, don't actually teach those, sometimes the practical skills of how to actually have those conversations, and especially from a cultural lens, if that makes sense. I think that, you know, a lot of courses, and I know when I studied social work and when probably you studied social work too, there was very little about how to work with an Aboriginal person per se. What are the skills that you would need that would differ in the communication skills units that we've actually talked about? And so the Aboriginal version of the courses actually really look like, well, let's have a look at what some of those skills would be to make Aboriginal people feel culturally safe in themselves, but also how do I, as an Aboriginal person, having conversations even with an Aboriginal person, how do I make that culturally safe as well for the person? You're right when you talk a little bit about mental illness has always been seen as a negative, has negative connotations. But what we do know is that, you know, in Australia, 1 out of 5 individuals actually have a diagnosis in any 1 year, and nearly 1 out of 5 people are walking around with signs and symptoms. For Aboriginal mental health, that's nearly double. So it's nearly 2.5 out of 5 that often have a diagnosed mental disorder, which is nearly half the population. So to have those conversations is just essential. And we can see that in, you know, rates of people that die by killing themselves, for example, makes up 10% of all people that kill themselves in any 1 year are Aboriginal and Torres Strait Islander people. So the conversations need to start. They need to actually be occurring. And what I love about the feedback that I get from the courses is that I don't always get to see the feedback immediately. It's not initial. You know, you go in, you do training for a couple of days, or you do it online, and then you don't see the participants again. But after training 10,000 participants, I'm running to them all the time, running into them on the streets, running them into the market. And someone will stop me and go, AJ, I'm so glad that you taught us that course because I was able to actually implement it. And then they share that personal story of their son or their nephew or their sister or their cousin. And I noticed that they weren't doing too well. And I had a conversation, and then I heard comments that I was a bit worried about, but I wasn't scared to ask them the serious questions. And they're alive, and I've been able to get them the support, and I've been able to work with them. That's when I hear how beneficial these courses really are. It's from the feedback that people share, real personal stories.
I wanted to share that you gave me the capacity to realize I have permission to ask the question.
Yes.
It's okay to ask it. And maybe the words may not come out right, but it's the conversation starter.
Yes, definitely.
When some people knew I was going to interview you, I had a question that I think 10 people asked me. They said, can you ask AJ? Because we really want his opinion. What does it mean when organizations say we want to provide a culturally safe space for our people? And I know that this is something that you've worked for many years. I know you've written in this area. So for our audience, people listening and those who are students who really want to understand it from someone has won award, many accolades.
I think cultural safety is it's a really big term, and it's really hard to define in just kind of a few little words. And cultural safety is something that a person needs to be able to feel, which makes it hard then to actually go, well, how do I teach you to make someone else feel culturally safe when in the end it's their cultural safety that you're actually looking after? But that means you could help organizations create guidelines or practices that reflect ways to make people feel included right from the beginning of their entry point into the service. And that might be, well, what would attract this person to want to come to this service? What does your service offer Aboriginal people, not just as an outcome, but as an entry point into the actual service? And it's also teaching organisations that if you're going to start putting things into place, then the staff need to actually understand the reasons why some of this stuff's being put into place. Just for an example, is that we often hear that Aboriginal people feel welcomed if there's flags up, for example, or there's artwork. Well, if you're going to put Aboriginal artwork up, you need to be able to actually also have a plaque around it about what that story actually is. Whose story does it belong to? What is it that you're seeing in the artwork? If you're going to actually have flags, every staff member must know what those flags actually mean, because if the staff don't know what those flags actually mean, and I'm an Aboriginal person coming in and I ask the staff, oh, I'm really glad that you like that flag. What do the colours mean? And they can't tell me. The purpose of being culturally safe isn't there anymore because the staff don't know what the flags actually mean. So how do I feel culturally safe with people not knowing that? And I think what I love about some of the courses I deliver, I get people to really think about, when does cultural safety aspects also become tokenistic aspects? And it becomes tokenistic when people don't actually understand why they are doing this, or why their organisation is doing it. Why does your organisation say that you must have in your email signature the acknowledgement of the traditional custodians and the flag? You know, that people walk around with lanyards on them with the Aboriginal flag and the Torres Strait Islander flag and also the Pride flag. And I say the same thing. If you're going to be an ally and you're going to be wearing those signs and symbols that represent what you're supposed to be allying in, then you need to actually understand what they actually mean in order to actually be the true ally. And sometimes they get challenged with that a little bit and people go, well, look, I'm here to learn and I want to know. And my question always back to them is, well, how long have you been wearing it for? And if they say I've been wearing it for the last 6 months, I go, so when are you going to learn? When are you going to actually change that over? So the cultural safety is just not just around the individual feeling culturally safe, but also making staff feel culturally safe in understanding the reasons why some of these things are put into place, but also getting staff to actually go back and actually going, you know what, let's look at all the structures that are in place, our intake process, our assessments, our discharge planning, and really have a good look through it to go, is there any barriers that Aboriginal people may face in any of these particular areas? And if there is, how do we go about fixing it? I'm also getting people to think about it from an Aboriginal lens, but the reality is it's from all the diversity areas as well. But I'm not there often delivering it on the diversity level, but if I can explain to you on from an Aboriginal lens, then maybe you can walk away and go, well, okay, if I understand this from an Aboriginal lens, how would this actually impact people that might identify as LGBTIQ+, or how do people with disabilities, or looking at the other intersectionalities that people have, what barriers would they face? And people come to me after the course and said, oh, you've made me really think about this, because some of the things that you suggest, we could use this for this particular culture as well. And sometimes I'm going, you could use it for everybody, but I'm here today to talk about it from the Aboriginal kind of lens.
I know you do a lot of mentoring
Yes.
of boys and leadership programs. I know that's very close to your heart. On with that as well, I just want to touch on one point that you raised for our audience, and you mentioned about diversity. And I know you personally how much support you've given me over the years in accepting me as a trans woman. Why is it important for rainbow mob, which is the term that's used, for families and that to understand and to accept our children and people being their true self? And does it fit comfortably with being Indigenous?
Ooh, there's a lot of concepts there. And I think that when you look at it from my own personal experience, I think I don't look at people and go, they're diverse. I look at them and going, well, what makes them them? Okay, everybody's got flaws, but everyone's got such positive attributes. we actually, society sometimes sees those attributes as things that are bad or things that we shouldn't talk around, like sexuality and gender. So instead of trying to put it into a box, what I like to do is actually like, let's not put it in a box, let's just put it out there. What is it? What makes Ricky Ricky? What makes the kids that I work with those individuals? So it is actually being able to pull them apart and actually going, well, I'm not here to judge you on who you say you are, because you are who you say you are. My job is to learn, and I try to get parents to look at the same thing. How do I learn to love the person that person actually is as a whole, rather than try to pigeonhole different aspects of this person to suit my narrative, rather than let's listen to the other person's narrative about who are they, what makes them them.
What advice would you give to an Indigenous parent
Yes.
whose their child has come out to them as either being trans or LGBTIQ?
I would say, one, don't panic. It's not a life-threatening disease to start off with. It's not a choice that the person's often making. The choice is that they're wanting to share that story with you. That's their choice of whether they're at a place where they're able to feel comfortable in actually coming out. I think it takes a very brave person to want to share that story with people, especially the young people want to share that story. But I also think it takes a very brave parent to actually stop and actually listen to that story. And that's why I go back to the narratives. I always try to explain to parents, this is not about you. This is not about your parenting. This is not about what you believe is right or wrong. This is what your child's actually trying to actually tell you about them. What are they thinking? What are they feeling? What makes them them? And if you love them, then you need to actually be able to hear the narrative that they're actually trying to tell. And it's okay if you don't understand it. And rather than try to hide the fact that you don't understand it, maybe if you actually spend a little bit more time talking to them, that you might actually be able to understand what some of the terms are, and what are some of the thoughts and feelings and emotions that are tied up in. We hear some very negative stories about people coming out to family, but I also hear some very positive stories that are coming out. And the interesting thing I would say in the last maybe 10 years of working with young people is I've been hearing more positive stories of people coming out, especially to their friends, because their friends are actually a lot more aware of the differences that are out there. But we're also getting into a generation of parents that are also becoming a lot more accepting. Maybe grandparents are still struggling a little bit with it, but I do see that there's a huge change. And I actually always tell people, never be afraid to tell your story. And I always say to people, never be afraid to listen to someone's story.
I think that's just such beautiful words, AJ. And I guess that leads nicely to, just before we almost wrap it up, is you won an incredible award that many of us were so proud of you and are still proud of you with the Australian Social Work Association. Tell us what it meant for you.
Are you referring to the fellowship, or are you returning to...
But the award of the year,
okay.
Social Work of the Year.
I think there's two things there. I won the Aboriginal Social Worker of the Year in 2021. And that was real recognition to me that the work I do in the Aboriginal space is recognised by Aboriginal peers, because it was Aboriginal peers of the social work that were on that particular panel. 2 years later, I won the Allied Health Awards Social Worker of the Year. And that was a completely different feel, because I was being assessed by other allied health professionals around my work with Aboriginal people, but also around my work with mental health. So it wasn't an Aboriginal specific award, it was an award that recognises the work that I have done and the impact that I've had on social workers across Australia. Just recently, 2025, I was offered the fellow of the SAW, and that's in recognition of about 27 years of work as a social worker, working with Aboriginal people across health in general. I'm running workshops on working with Aboriginal people, on Aboriginal mental health first aid, on Aboriginal people in childbirth, early childhood, and birthing, and I work at hospitals teaching nurses around childbirth and a lot of aspects around Aboriginal health. So that was pretty amazing in terms of the SAW themselves going, we recognise the work that you've actually been able to do. And I feel really proud to be able to accept that fellowship as well.
You're doing so many incredible things, but one of the things I'm super excited about is you've been doing for, I think, quite a few years now, your podcast series.
YarninBlak.
YarninBlak. But you're also doing 2 other new podcasts.
I'm doing one with Darcy Macaulay Bartlett on 2 men that are just sitting down sharing their stories. And the other one I'm doing with you called Health Bites, which I'm really excited about. It's coming out in September, which is really exciting. And it'll be looking at topics that don't normally get discussed in health and breaking them down. And we're going to have people with lived experience, professionals to help explain what some of those conditions might be like.
It's been an absolute honour and privilege today having my dear friend AJ Williams, somebody who's spent the last decades really making a change in this country, across the country, not just for Indigenous peoples, but for everyone, to make mental health training accessible for everyone. It's been an honour and privilege. AJ, thank you so much for spending some time with us today.
I loved it. Thank you.